Is a runny nose a symptom of the flu or just a cold? A runny nose is a common symptom that can appear with both the flu and the common cold, but understanding the differences can help you figure out what you might be dealing with. Usually, a runny nose is more associated with colds. When you catch a cold, symptoms tend to develop gradually and include a runny or stuffy nose, sneezing, and a sore throat. These symptoms are generally mild and tend not to cause serious health issues. In contrast, the flu often hits suddenly and with more intensity. If you have the flu, you might experience a high fever often above 101 degrees Fahrenheit, chills, muscle aches, headaches, and a feeling of extreme fatigue. While a runny nose can happen with the flu, it is less common and usually less prominent compared to the other symptoms. When the flu strikes, systemic symptoms like fever and body aches tend to overshadow nasal symptoms. So, if you notice a runny nose without a high fever or severe body aches, it's more likely you have a cold. If your runny nose comes with a sudden high fever, chills, and muscle pain, the flu could be the culprit. Because symptoms can overlap, especially in the early stages, healthcare providers might recommend testing to confirm whether it is influenza, especially if you are in a vulnerable group or if complications could arise. It's important to remember that both illnesses affect the respiratory system, but their severity and accompanying symptoms differ. Colds usually cause milder symptoms focused on the upper respiratory tract, like a runny nose and sneezing. The flu, however, can lead to more serious complications, especially in young children, older adults, or those with certain health conditions. In summary, a runny nose alone is more typical of a cold, but it can appear with the flu as well. The key differences are how quickly symptoms develop and the presence of high fever and body aches, which are more characteristic of the flu. Always consult a healthcare professional for an accurate diagnosis and appropriate treatment, especially if symptoms worsen or if you are at higher risk for complications. Remember, understanding these differences helps you take better care of yourself and seek timely medical advice when needed.